In this video series, we will discuss some of the common myths and facts regarding life after kidney donation.
We will talk about the following 5 myths.
I will have to change my lifestyle forever if I donate. I don't need any follow-up after kidney donation. I'll have to take medications for the rest of my life. Having a single kidney will affect my sexual function and fertility. I can be pregnant after kidney donation. Here's a common myth that I will have to change my lifestyle forever. After donation, you really shouldn't have to change your lifestyle as such. You should be able to return to routine lifestyle after 10 or 12 weeks. You'll be advised by a transplant team about what activities you can do during this early recovery period and when you're able to resume other activities. This includes having a healthy diet, light exercise, and sports gradually built up over time. You do have to be careful not to exert yourself too strenuously in the beginning while you're healing. A pledge to a healthy lifestyle is very important to support good long-term health after donation, including regular exercise, healthy diet, and avoiding the use of tobacco.
In the United States, transplant programs are required to collect information on health status and some lab values at 6 months, 1 year, and 2 years after donation. If you live far from your transplant center, this follow-up can be scheduled with your local doctor and results can be sent to the transplant center. This early follow-up is required so the transplant center can keep track of your health early after donation and help if there are any problems. After the first 2 years, your transplant program will make recommendations for lifelong annual follow-ups with your primary doctor. For kidney donors, this should include measurement of blood pressure, body mass index, kidney function testing based on blood and urine, and review of mental and social health and well-being. The transplant center should always be a resource for any questions you or your doctors have about your health. Some programs have strategies for covering the follow-up. Talk with the transplant center to create a personalized follow-up plan before donation. Many donors consider their donation date an important anniversary. Along with celebrating the gift of life, this date can be used as a reminder to keep up with your follow-up appointments and staying healthy.
Now let's talk about medications after donation. Some people think they have to take medications the rest of their lives. Right after surgery, you may need to take some medications related to pain control. But as such, once you've donated, you should not need to take any extra long-term medications related to donation. You should also be able to continue your pre-existing medications after kidney donation. However, as there are changes to your overall kidney function after donation, you do need to follow up with your primary care to monitor certain aspects such as hypertension, which on occasion may require treatment in the distant future. With a healthy diet and exercise, it is quite possible that just like the general population, you can avoid needing medications for conditions like hypertension and diabetes in the future. If you have any pre-existing medical conditions such as hypertension or other minor conditions which are related to kidney function, it is possible that those medications may need to be adjusted or changed after donation. This is not common though, and your primary care and transplant team will educate and advise you if such an issue may arise in your case. If in the distant future during your annual follow-up with your primary care doctor you are in need of a new medication, in most cases you will be able to use such medications.
If you choose to become a living donor, your kidney donation should not affect your sexual function or your ability to reproduce. Male donors who are fertile are able to father children, and fertile women donors are able to get pregnant. Living donation should not affect your ability to become pregnant or have children. Many living kidney donors have children after donating a kidney without any impact on the pregnancy or their own health. Female donors are encouraged to wait for at least 6 months after donation before trying to become pregnant in order to allow time for the body to heal from donation. All women who become pregnant after donating a kidney should be seen by their doctor regularly throughout their pregnancy to check their blood pressure, kidney function, and the developing baby's well-being. Some studies suggest that kidney donors may have a small increase in risk of pregnancy complications such as gestational diabetes, pregnancy-induced hypertension, preeclampsia, and protein in the urine. That is why it is important that donors who become pregnant after donation have ongoing prenatal care throughout their pregnancy and after delivery. To further lower the risk of complications during pregnancy, staying active, eating healthy foods, to stay at a healthy weight, and avoiding smoking is recommended.